Hello, I'm Arvind Dasari, a medical oncologist in the Department of GI Medical Oncology at MD Anderson Cancer Center. Today, I'd like to talk about a phase 2 clinical trial evaluating a peptide vaccine, EO-2040, in combination with nivolumab, which, as you may be aware, is an immunotherapy drug in colorectal cancer patients with circulating tumor DNA-defined minimal residual disease. Starting with some background about the vaccine, this is built on the concept of microbiome mimicry. The gut is full of bacteria, and the body recognizes the peptides or proteins from these bacteria as being foreign and develops an immune response. This vaccine identifies peptides that are common to the gut bacteria and the colorectal tumors. The hope is that with this approach, there are no personalized vaccines required. So this is an off-the-shelf approach. And furthermore, because the body's immune system already has immunization to these peptides, the immune response would be both faster and stronger. Similar vaccines utilizing the same concept have already been evaluated in other difficult to treat cancers, including glioblastoma, adrenal cortical cancer, and some lymphomas. These early trials show that these vaccines are safe and well tolerated, and also that they're associated with strong immune responses and promising early signs of efficacy. These vaccines are being evaluated in larger ongoing trials. The vaccine being used in the current trial, EO-2040, has peptides that are highly expressed in colorectal cancers and with low expression in the rest of the body and other normal tissues. So this makes the vaccine both effective and safe. In the current trial, patients with stages 2 through 4 colorectal cancer, after completion of all definitive and curative intent therapies, for example, surgery, in addition to any planned chemotherapy before or after such surgery, and who are undergoing surveillance for recurrence when they're found to have a ctDNA relapse, but without evidence of radiographic disease. That is, they are MRD positive, will be first evaluated for HLA-2 subtype. This HLA-2 subtype is required for the vaccine to be effective and is seen in approximately 50% of the population. If the patients are positive for this HLA subtype, they then will be evaluated through additional screening for the rest of the inclusion and exclusion criteria. Eligible patients will be treated with the vaccine in combination with nivolumab. The primary endpoint of the study is ctDNA clearance by the end of 6 months. Depending on the results of the first cohort, additional cohorts may be added on with necessary modifications. This is the study calendar. As I mentioned earlier, there will be 2 steps to the screening process, initially for the HLA subtype, and then for the rest of the inclusion-exclusion criteria of HLA-O2 subtype positive. Eligible patients will be treated with EO-2040 vaccine plus nivolumab in 2-week intervals times 4 doses during the priming phase, followed by monthly administration of both these drugs during the boosting phase. Patients will be evaluated with scans every 3 months while on study and every 3 to 6 months, or as thought appropriate, by the treating providers. In addition, they'll also receive ctDNA testing. For further information, please refer to the listing on clinicaltrials.gov for this trial. Listed also is the contact information for the Gastrointestinal Center at MD Anderson, where this trial is open to make appointments. And you can also reach out to me through my email. Thank you very much.